welcome. Thank you for attending my presentation. Today I'm going to be talking about Healthy People 2020 goal of glycemic control and how to improve glycemic control. Here's a PowerPoint for your reference. So, why does improving glycemic control matter? There are several complications that can happen if you have high blood sugar that is not controlled, especially over a long period of time. One complication is renal disease. So diabetes can cause microvascular changes in the kidneys. This occurs when the renal filtration mechanism is stressed, and that can cause increased pressure in the kidneys. So over time, it causes damage, and proteins can actually leak out of your kidneys into your urine. Another complication is cardiovascular disease or heart disease. With this, increased blood glucose can promote excess lipids or fatty substances in the arterial blood vessels. It can cause red blood cell dysfunction, platelet accumulation. When you have platelet accumulation, it puts you at risk for stroke. The blood cells will coagulate together. And then also it's important because you are at risk for development of CAD or coronary arthrosis, heart disease. More on that, because heart disease is such a important consideration when you're talking about glycemic control. It puts you at risk for, diabetes puts you at risk for a heart attack. Again, those lipids accumulate in the arterial blood vessels, in the lining of them. It increases the risk for muscle damage. When you have muscle damage, increased accumulation of lipids, it narrows those arteries. Well, when an artery narrows, you have decreased blood flow. And that is important because blood flow, you're not getting as much blood oxygen where it needs to go. So that will damage the heart. It's called ischemia, which is a decreased amount of oxygen, and that puts you at risk for a heart attack and death. There's something called retinopathy. There's three neuropathies, and what we'll talk about first is retinopathy. We've already discussed the nephropathy, the renal disease, but retinopathy is where damage occurs to the small red blood cells in your eyes that bring blood flow to your retina, and it can cause blindness. It's actually the leading cause of blindness for people age 20 to 74. It's important because a lot of the times people are not aware their blood sugar is high. So over a long period of time, if they're what we call asymptomatic, they don't have symptoms, these problems are happening, but the person is sometimes unaware of it until, it's out of control. But the last neuropathy is called peripheral neuropathy. It's most common. And what that is over time, increased blood sugar will damage the nerves in your distal extremities, your fingers. It's most common in your legs or feet, toes. And what that is the patient will have numbness, burning, decreased sensation. It is important though because the decreased sensation and numbness can actually be detrimental to a person's functional status. And what I mean by that is, how they walk, They're more at more increased risk for injury because they can't feel what they're stepping on. So if they're stepping on hot concrete, they won't feel it as someone without neuropathy would feel it. And they can get burns and wounds. And something to consider is people with increased blood glucose do not have the healing capabilities of someone who has normal blood glucose, so they are at increased risk for non-healing wounds. So treatment. Treatment is very important. There's many types of treatment for diabetes, but I kind of narrowed it down. In primary care, I feel with 3 drugs the most. So I've narrowed it down, even though there are lots more treatment, I've narrowed it down to 3 that we'll talk about today. The first is metformin. This is an oral medication for diabetes. It regulates blood sugar. And it does this by increasing insulin sensitivity. Second is Novolog. It's a short-acting insulin. And the third is Lantus. It is long-acting insulin. And the insulins are, they promote glucose transport. They're pancreatic hormones. So we'll talk about metformin first. So some good side effects, things we want it to do is lower your blood glucose. Something we do not want it to do is when you take metformin, you also have to be screened regularly for renal problems, for kidney problems, because it can cause that. So you would want to take that into consideration. Here you have someone who is diabetic who is prone to renal problems like we just discussed, and then you give them a medication that can further complicate that. So it's a process that the medical provider has to look at when prescribing this medication, and routine screenings would be appropriate. Side effects to metformin the most common side effect that I have run into would be gastrointestinal GI side effects, and the most common is diarrhea. A lot of times we have to titrate the dose up slowly so that the patient is able to tolerate it to whatever the maximum dose the physician deems appropriate for that person. But nausea, diarrhea are very common and something to look out for if it does not resolve. All right. Novolog. I picked Novolog. There's different kinds of short-acting insulin, but this is just, again, a common one that we, have dealings with in primary care. So Novolog is a short-acting insulin. You give this, if you were to give this to somebody, prescribe it as a medication, it can be prescribed many different ways. The most common way that I have seen it prescribed is by sliding scale. So there are different sliding scales that providers will choose, and they will pick the appropriate one for the individual patient, but they will have, the patient will check their blood sugar however many times a day. Typically, we'll say 3 times a day, and depending on the number they get for their blood sugar, they will reference a paper that gives a range. If it's between 200 and 250, give 5 units. So that patient will know to give themselves 5 units of Novolog, and it's a short acting, so it will bring their blood sugar down quickly. Considerations for this medication is you want to provide patient education on, you would never want someone to give themselves short-acting insulin if they're not checking their blood sugar, because it will drop them fast, and that could be detrimental for them. It can cause low potassium, and so again, and with these diabetic medications, you want to always make sure they're having the appropriate screenings as indicated by their medical provider. Lantus. Lantus is a long-acting insulin, decreases blood sugar over a set amount of time. It's typically given at nighttime. Sometimes people take it at night and in the morning. It just, again, depends on a specific treatment plan for the patient. But it's not going to drop you fast. It's going to more try to regulate you throughout the day. So the difference between this and Novolog we just discussed would be, you want to always be checking your blood sugar the way your provider says, but you wouldn't have to necessarily check it right before you give the medicine because it's not going to drop you as fast. All right. Something that's really important to this Healthy People 2020 goal of improving glycemic control is what's keeping these patients from having good glycemic control. What are the barriers to their treatment? So some things to consider is, how does the patient view their own health status? Do they think they're sick? Like I said earlier in the presentation, a lot of people don't realize that their blood sugar is out of control. So if they don't see any symptoms or experience any symptoms, why are they going to take medicine? Could be something that they possibly think about. So that's one thing to consider. How do they view their status? Then you have the other side of that, whereas maybe someone has very decent glycemic control, but they're still very worried about it. It's just all on an individual patient basis, and you want to make sure to assess for that. How do you feel, this affects the individual patient? So if a person was to view their blood sugar, their elevated blood sugar as maybe not a significant problem, but as a medical professional is explained to him or her, the risks, short and long term, the complications that we just went over, it might persuade them to take a closer look and be more proactive in their treatment plan. So good communication, patient education, patient teaching is crucial when you have, especially patients who are newly diagnosed. You want to make sure you give them all the tools they need to adequately manage their disease. So that's something to keep in mind. Also, what is a patient's motivation for health? Are they motivated because they want to prevent a heart attack? Prevent renal disease? Are they not motivated? Do they not care? And maybe what are the reasons behind that? Do they have depression? Do they have, you need to assess all the comorbidities to develop an effective treatment plan. Maybe they don't believe in taking medicine. That needs to be considered, because patients will not follow a treatment plan that is not culturally sensitive, specific to their needs, and something they can afford also. Medications can be very expensive. So you have to take a holistic look. Not having a good health history can be a barrier. If I'm a medical provider and I'm prescribing a treatment plan for someone with uncontrolled diabetes, and I prescribe this plan here, and I don't know that they've tried this and it failed, am I really helping them by sending them down that path again? So you need to make sure you have a comprehensive medical history to evaluate what has been tried, what they, and habits too. What good habits do they have with blood sugar control? What good habits or what bad habits do they have? You have to take it all into effect and create a personalized approach for them. That's the way to benefit for that. Okay, I am finished with my presentation. I do have a course review that I would like to discuss with y'all. Okay, so I'd like to ask a few questions. What stands out to you as the reason glycemic control is important?
It can prevent a lot of other health conditions if you keep it maintained and controlled.
That's right, it sure can.
Yes.
Which morbidity risk concerns you the most? Which that we talked about, heart problems, kidney problems, eye problems. Is there something that stood out to y'all as being very important?
Of course, your heart, but the losing feeling in your feet and injury and slow healing, that was especially important.
It is, because if you develop a wound and especially if you don't know about it, I mean, it can lead to amputation, infection, can be bad. That's a good point. Have you had any misconceptions that maybe I've clarified today on glycemic control?
Well, I guess I didn't realize that so many other chronic health conditions could be minimized just by controlling your blood sugar.
Mm-hmm. And we only touched on a few today. There are more, but you're right. Uncontrolled blood sugar just exacerbates those other comorbidities. Which medications do you recall that we discussed today that you thought could be helpful to glycemic control? Do you feel like the oral medication or the injectables? And you have to keep in mind, we always want a plan that patients will follow. Some people don't want to inject themselves, you know. So was there anything that stood out with those medications?
Well, I think the success of it depends on the patient. You can prevent needing insulin if you maintain your diet with the oral medications. Is that true?
Yeah, it can be true, absolutely.
Okay.
Speaking of that, what factors do y'all feel plays a factor in patient compliance, plays a role in that?
I think education is going to be a big part of it. Why do I need this? Something I've heard before, well, I'm young. You might be young, but if you have a very serious health condition, your life can become very short.
That is a very valid point, yes. It's a very valid point. There are so many possibilities to barriers of good glycemic control. It is very patient specific. But education is key. Thank you. What about patient lifestyle factors? Do you think that would play a factor in glycemic control? Maybe they don't want to follow a diet.
Absolutely, and it depends on their lifestyle too. What if they're very, have an outdoors lifestyle? They have to really plan on their medications or oral or injections. What's safest to bring with them or easiest to take, most convenient.
That's a good point, especially if the injectables need to be refrigerated. So if someone is going to be away from their home for 12 hours, is that, they may need a backup plan.
Absolutely.
That they've discussed with their provider. And lastly, do you feel that evaluating patient behaviors, routines, and habits would affect their management? If as a provider, you were to evaluate that with the patient, do you think that would help control their blood sugar?
Yes, I think that a big portion of it falls on the patient though, themselves, as far as wanting to put down the sugar and step away from all these things that are so tempting that they know is going to do exactly opposite of what needs to be done. So
Yeah.
do patients care really that they have to stop eating these things? Do they want to stop eating these things? Do they want to exercise? Are they able to exercise?
Valid points. And that just goes back to a patient-specific treatment plan and increased patient education. So, all right, I think we're finished here. I appreciate y'all's attendance, and thank you very much.